Good morning, good afternoon, good evening to everyone, and welcome to my presentation. My name is Rachele Fabbri, and I'm a graduate student of the Master in Biomedical Engineering of the University of Florence. During this presentation, I will show you my study, a clinical decision support system for leukemia based on artificial intelligence. This work comes from a collaboration within the Department of Information Engineering of the University of Florence and the Careggio University Hospital located in Florence too. The goal of this study is the development of a clinical decision support system for patients affected by leukemia. Leukemia is an heterogeneous group of hematologic diseases characterized by neoplastic proliferation of an hematopoietic stem cell. So when a patient is affected by leukemia, his blood cells are replaced by blasts or leukemic cells, which are cells not completely differentiated and so that cannot fulfill their functionality. Leukemia can be divided into four subtypes based on the cells that is affected, so myeloid or lymphoid, and also based on the rate of progression of the disease, acute or chronic. So we have acute myeloid leukemia, acute lymphoblastic leukemia, chronic lymphoblastic leukemia, and chronic myeloid leukemia. And in this work, we have analyzed the data from patients affected by acute myeloid leukemia. For the patients affected by this disease, there are some guidelines for their risk stratification. These guidelines come from the European Leukemia Net, which is a net among the different centers of research that work all over Europe. And they suggest that three risk categories can be identified. We have favorable, intermediate, and adverse risk category. Based on this stratification, clinicians take the decision about the intensity of the treatment to provide to the patients and also to assess the necessity of a hematopoietic cells transplantation. From the literature, we know that this stratification works well both for the favorable and adverse category. However, the intermediate risk category still poses some challenges. In particular, an high heterogeneity in terms of survival is observed, and the causes of such an high heterogeneity are not known. So in this work, we tried to consider a new category of mutations and we investigated if such new category can help to better stratify the patients of the intermediate risk category. So our databases comprises the data from 83 patients affected by acute myeloid leukemia. We used the data from the nanopore sequencing of DNA, and in particular, we considered the copy number variations in terms of their type, range of length, and variant allele frequency. Together with the data from the nanopore sequencing, we also consider clinical, cytogenetic, and molecular data. The output of our system is the overall survival at 2 years from the diagnosis of acute myeloid leukemia. So we built a binary classification system. As for the methods, first of all, we divided our database into two subgroups because some patients have undergone an hematopoietic cells transplantation, and some other patients do not have this transplantation. So first of all, the data have been pre-processed. In particular, we applied normalization, and then we analyzed the imbalance of the classes and applied oversampling when it was needed. Then we performed feature selection and we compared the performance in terms of accuracy of 6 classifiers: k-nearest neighbor, subtle vector machine, decision tree, random forest, naive Bayes, and logistic regression. The classifier giving the highest performance has been chosen as the final model. It has been optimized and used to predict the overall survival at 2 years for the patients affected by acute myeloid leukemia. So we obtained the best performance with a logistic regression algorithm, giving an accuracy of 83.3% for the cohort of the non-transplanted patients. We obtained worse results with the patients undergone the transplantation. So in conclusion, we can say that the study proves that the number, type, and length of copy number variations in patients affected by acute myeloid leukemia can be a valuable feature to be considered when the aim is to develop a clinical decision support system based on machine learning to predict the overall survival of the patients. Of course, we think that further improvements should be carried out. In particular, a new cohort of patients should be used to validate our results. However, this system is a disruptive advance to help clinicians in predict the response to the treatment by the patients. So thank you for your attention, and those are my contacts.